right.
Okay, we're rolling.
Rolling.
So, hi everybody. It's Health Literacy Month, and as promised, we're talking to lots of experts. And today, we're talking to Dr. Coop, Dr. William Cooper. How you doing today?
I'm doing great, Lisa. How are you?
Good. So we only have a few minutes together, but we have a few questions for you from the public.
Great.
But before we jump into that, just give people like a 1 or 2 sentence bio. Tell them about yourself.
Yeah, I'm a heart surgeon. You and I are classmates, so we've been doing this a very long period of time. We were baby docs. I have been in academics at Emory University for a number of years. I also practiced in private settings. I'm also an entrepreneur and business owner. So right now, and you and I share an interest in really public education around health and medical related issues. And that's particularly of importance nowadays during this pandemic with COVID and the coronavirus.
Yeah. So we're talking about heart health today. So this is in our What the Body Do series. So I think people have a good idea about what the heart does. It gets blood to the rest of the body. It keeps you alive. But let's talk about heart disease. So if you had to give people one piece of advice for what they could do to prevent heart disease, or if they already have it, to stop it from getting worse, what would you say?
I would tell you something, Lisa. You know, years ago, I had a difficult time answering that question, but today it is absolutely the single most important thing that you can do for your heart health is change how you eat and your nutrition. It is number one. You cannot exercise your way to heart health and go down the street and eat the local greasy burger and think that you're going to be heart healthy. You are not. And in fact, the data is really starting to point to plant-based diets as the foundation of a really good, healthy lifestyle in general. I mean, and not only just
heart disease. Are you saying no
disease.
meat? Is that what you're saying?
Well, I'm not saying no meat, but I'm saying, and I'm not even saying moderation, because we kind of let ourselves off the hook sometimes. We say moderation, you know what I mean? Mm-hmm. But I'm saying that you should be really thinking about moving towards 80 to 90% of your diet being really a plant-based diet, and that is, I mean, I'm not even there, okay? And I'm not going to sit here and point fingers, but I mean, I'm not there. It's tough. But if you really want that one thing is really nutrition. And I hate to, you notice I haven't used the D word, diet, because that has been bastardized and really commercialized in ways that are not healthy for all of us. But it's really about healthy nutrition.
Well, let's talk about how hard this is. So it's hard for me too. I mean, I struggle with my weight and eating the right foods all the time. So when you say a plant-based diet, are you saying only eat vegetables, no grains, no bread? Like, what are you saying?
That's a very good question, Lisa. And so, so let's drill it down a little bit more to try to give people give you a way out. Okay. If I can give you a little bit of a way out. So it's fruits, it's vegetables, it's whole grains, and and quite frankly, to be honest with you, from my perspective, I think healthy seafood is actually important, because that gives you a little bit more higher density protein. But I think the thing that, rather than try to go full out in terms of just going there in a full plant-based diet, what is it about the way we normally eat? What can we eliminate in what we normally eat without going to that extreme? Because I've been there, tried that extreme to go plant. I mean, it's tough. Mm-hmm. So here's the thing that we are really over consuming in our diet. It's not carbohydrates, okay? It's not even fats. As you know, fat that we eat, cholesterol, generally just doesn't even get absorbed in our system.
Oh, let me guess.
Yeah, it is sugar.
Sugar. Yeah.
Sugar. And it's refined sugars. And it's in just about everything we eat. So if you wanted to, what's that? Yeah, it's in ketchup, mustard, anything. I mean, literally, it's everywhere. But it's unfortunate that the labeling, the USDA has allowed labeling that allows food manufacturers, food processors to kind of mask it. I mean, because it comes in all forms: sucralose, fructose. You'll see all these different names: high fructose corn syrup, and those things. But it's in almost everything we eat. So if we could just really start to focus in on that one thing,
Sugar.
we wouldn't have to go so extreme to trying to be the total, because that's what you're really giving up when you do the plant-based. Now the plant is adding a lot of other great things to for you, a lot of antioxidants with the omega-3s and with the fiber and the phytosterols and things like that. So you're getting a lot of wonderful stuff with the plant-based. But I think the thing that we're getting an overabundance of right now in place of those things is really the sugar that's in most of the foods and processed foods that we eat.
So let's talk to people who live in places where they don't have an abundance of the food you're talking about. So maybe they shop in the corner store, or even when they go into the Kroger or the Meijer or the Albertsons, whatever, Safeway. A lot of people put things in their basket like the boxed macaroni and cheese, the ramen noodles, Oreo cookies, whatever it is. We haven't done a good job teaching people how to make those selections. So what are people to do?
Yeah, so I think you're absolutely right, and so that becomes not necessarily so much a people problem. It becomes one of those social determinants of health. Quite frankly, one of those things that just by virtue of where you live, you're going to have, or you may be compelled in some instances to have a very unhealthy diet. Because you don't have access to anything else. I mean, we take it for granted that we can just jump in a car and go wherever we want to go. But there's no Whole Foods in the hood. I mean, I'm just telling you, I haven't seen one yet. I mean, let's keep it real. And I don't want to slam Whole Foods, but the fact of the matter is, those are the types of things and the type of variety that we need to be looking at. But, even with that, I will say this is that, it takes a very, very conscious, committed effort to really think about it. I think that's where we lose. I think most of us are not really eating consciously or just living consciously in general, but we're not thinking about it. When we go into these places, and then there's one thing I will say. I've gone into a lot of little convenience stores, in urban America, all around the country. And it's very interesting. A lot of them will have that little rack or little tiered tower thing of bananas and apples and stuff sitting by the front door that the local guy is trying to make a little money and comes in there and sell. And so we need to start thinking about.
But in my neighborhood, William, that fruit is rotting.
Is it? Yeah. Well, yeah. I mean, that's a problem, but I mean, that's the nature of the condition in which some of these transactions and things occur. But at least they were trying. At one point, it wasn't rotten. Hopefully they didn't put it on the shelf rotten, but guess what? People didn't buy it, so it just rotted. You know what I mean? And that becomes a problem. But I think if we start focusing in on that. But then the other thing that I tell you that I think is really a movement that I first saw here in Atlanta probably 20 years ago, is the concept and the idea of these community gardens, taking abandoned land lots and yards and stuff and starting these little community gardens. I tell you, one city that I read something here more recently was Detroit, where they really the city started to reclaim abandoned properties, old manufacturing sites, and started just putting in community gardens where people could go in there, take care of it, and plant fresh fruits and vegetables that people could consume. And then they could go to the local butcher and get, the chicken or the fish or whatever else they may want. So I think but I think, it boils down to, although we know we have problems with these food deserts, we really still have to do everything we can to consciously think about how we are providing the fuel for our bodies on a daily basis.
Yeah, I feel like you and I need to have an ongoing series, maybe once a month, talk about some aspect of food to make this more practical and accessible, because making all these changes is really hard. I mean,
invitation accept.
Right on.
Fits and
All right,
cool.
well, let's
Fits and cool.
let's pivot a minute and just talk about these questions we have from social media.
Okay.
Someone asks, atorvastatin. They take atorvastatin, and it messes with their equilibrium, so they feel off balance, and they feel disoriented and falling, and like they're going to fall, or they feel jittery. Like, what is that? Why is that
Mhm.
happening?
Yeah, so that's what we call one of those idiosyncratic reactions to the
Ooh, that's a
statin
big
drugs.
word, Dr. Williams.
Yeah, it just means we're idiot and it's synchronous and we don't understand what it means really.
No, that's the thing about doctors,
so,
right?
so when doctors don't know something, they throw a big word at it. We're just dumb. And I'm being honest, we really don't know why that is. But there are some people who will have what are probably not the most common reactions to the statin drugs. Here's what I would say, however. First and foremost, make sure that you're taking it for the right reasons. I mean, as you know, Lisa, we get people coming to our office and on 25 medications, and you're like, where did this come from? What is this? This is not normal. So make sure, first of all, that drug is being prescribed to you in the appropriate manner. Secondly, I would say make sure it's doing what it's supposed to do, if in fact it is being prescribed appropriately. But then also, if it is, remember that within that class of drugs, the so-called statins and cholesterol-lowering drugs, there are a number of different ones. And so you can try different ones that perhaps won't give you that same idiosyncratic or weird, I'm just gonna call it weird kind of feeling. I mean, I've had that with medications that I've taken where, in the same class, where one gave me this and the other one did not. But they, however, effectively were doing the same thing and I was getting the same outcome. So guess what? I switched to the one that did not have that reaction. So I think it's important to consider other alternatives to atorvastatin. There are others that rosuvastatin and several others that I could name that you could potentially use that could get the same result without the side effect.
And have you seen atorvastatin cause mental health issues or bad dreams? That's another question related to that drug.
I have, Lisa, just about everything that you can imagine, I've heard over the years that's been attributed to some drug, including the statins. That one, however, I can't recall specifically, and I'm not just thinking about the product and the fact I use it every single day with my patients. I don't recall that was one that's been very prominent.
Okay, good. So the next question is a cardiologist and a pulmonologist the same? And if not, how are they different? It's a great question.
Yeah, very good question. So cardiologists are people that primarily specialize in diseases of the heart. A pulmonologist is a physician who primarily specializes in diseases of the lungs. And so that's how they differ. One's taking care of the heart, one's taking care of the lungs. Now, there's a lot of crossover there because, as you know, the heart and the lungs are very intimately located near each other. And
well, I know that, but
yeah.
A lot of people, when we have our organ model out on the street, they actually don't know. They didn't know the heart and the lungs are so close together.
Yeah. The heart literally is surrounded on both sides by the left and right lung. It sits right in the middle. And so they're intimately involved with each other. And oftentimes conditions that affect one will affect the other. And so cardiologists and pulmonologists work very closely together in a number of patients who suffer from either or of the condition of the lung or the heart.
Okay, and then the last question we have for you today is about COVID. And this is, should I get the vaccine or should I be worried about the heart problems that come with the vaccine? What do you think about this, Dr. Cooper?
Yeah, so the way I approach
first of all, what is the heart problem with the vaccine? What is the person asking about?
Yeah, so there have been there's a couple of things that the way that the virus affects the vaccine and the virus, because you got to remember now the vaccine is mimicking creation of the spike protein of the coronavirus. And in that regard, it elicits similar type of response in your body. So there's two things. One is, but the difference with the vaccine and the actual coronavirus itself is the the vaccine doesn't necessarily attach to the heart, but we have seen cases where people have actually had coronavirus that has directly affected the heart muscle. And we've seen that under microscopic slides, okay? And then one of the other big issues with the virus itself, not the vaccine, I'm being very, very emphatic about that. The virus is that it affects the lining inside blood vessels, and that's called the endothelium. That's the inside lining of the blood vessels. And so that creates a problem with inflammation, and then that inflammation leads to clotting and blood clotting. That's why we've seen so many blood clots in people with the coronavirus. The vaccine does not tend to have that same effect, although, okay, because it is essentially an analog, if you will, for lack of a better way to put it, it is making your body produce the spike protein, okay? At least the Pfizer vaccine and Moderna are doing that. That is your body sort of responding to it very similarly. So it's not unusual that people would have some of the side effects that almost mimic the coronavirus. But here is the kicker, okay? The effect of the virus that the virus has on your body in regards to creating these really deleterious and really powerful inflammatory reactions is nowhere near the coronavirus. So yes, there are side effects with everything, including the vaccine.
You mean the vaccine? The vaccine, the side effects are nowhere near the actual coronavirus. So it's
exactly.
If you get COVID, then you're more likely to have heart issues than if you get the vaccine.
Yeah, 100 times more likely. And I'm just throwing out a term. You're 100 times more likely. So yes, we've seen some sporadic cases where people have gotten the vaccine and had some cardiac effects of it, but that pales in comparison to literally universally people who get COVID are at risk for developing some cardiac related complication.
And when you get the vaccine and have one of these heart impacts, so the swelling of the heart, does it reverse itself, or are you stuck with that?
Yeah, I've seen some data, and this is a very good question. I got to go and sort of read up on this, but one of the areas in where this is come up is in athletes young athletes who otherwise were just fine, but then later on they developed heart-related conditions like congestive heart failure. So in some cases, it does seem to be, or it can lead to the so-called long haul syndrome, which I don't like using, but sort of a chronic kind of a condition. I do not and have not seen a case where that was directly attributed to the vaccine. I've seen that where it's been attributed to the actual coronavirus disease or the virus itself, not the vaccine.
Okay. Well, we're hanging with Dr. Coop.
I love it.
We'll see you again next time. And I just want people to know, I really am so impressed by your commitment, your passion. Like, you're the only heart surgeon I know who wants to put himself out of business because you want people to be healthy.
No doubt about it.
Or at least you're very honest and open about that. Maybe Absolutely. There are others, but I haven't heard them proclaim that or even write a book about it like you have. So thank you so much for the
Put me out of business, please. There you go.
Yeah. So we'll see you next time, Dr. Coop. Thanks
All right.
so much.
Take care, Lisa. Thank you. Bye-bye.
Bye.